So welcome to Healthy Beginnings Fitness, Emma. Thank you for taking the time to be with us today. Can you tell us what got you into your chosen field in the first place?
Yeah, I worked in an office to begin with and then thought, I can't work like this, it wasn't suiting me, so I decided to go and become a chiropractor because I used to get really bad headaches, and I got some chiropractic treatment and it worked wonders. And yeah, so off I went to university for 5 years, and because chiropractic is a 4-year full-time degree and I had to do extra sciences to start with, so that's my background. And then post-grad I have done research and further education in pregnancy and paediatric work and also animal work.
And you're a mum yourself, aren't you?
I am a mum myself. I have a 2-year-old, Amanda, who is a little terrible two-person at the moment. So I know what it's like, and I know what it's like to be pregnant and obviously go through all of that. I had quite a traumatic time myself. Amanda was 2 weeks overdue, so I've been that big person with all the aches and pains. So yes, I sympathise and empathise with anyone out there who has all the problems.
Yeah. And can you tell us exactly what a chiropractor does?
Yeah, in the easiest way of thinking about it is we're mechanics basically. So we are looking at the way your nervous system is functioning, the way your muscles are functioning and your joints are functioning, so the three interlink. And if there's a problem primarily with the nerves, because the nerves send signal to your muscles and your joints and your organs and things, then that's going to create a pain cycle and you're going to become symptomatic. So what we do is we use various orthopaedic tests to find where the problem is, and we diagnose your problem, talk to you about what's going on, and we try and get your mechanics, in other words your joints and your muscles and your nerves, working again. The various treatment forms that we use, the classic one being the chiropractic manipulation or the adjustment, which is the cracking that everyone associates with chiropractic. But we also do soft tissue work, which is basically, it's not a full body massage. If you have an area that's in a spasm, then we get old pokey thumbs and we release that area that's in spasm to try and get that muscle functioning better. We also do little gentle work onto the ligaments to try and release the ligaments off, because if they're tight they're going to affect the way that you're moving as well.
Excellent, thank you. Is it safe to have to visit a chiropractor during pregnancy?
Yes, absolutely. So like I say, a lot of people associate chiropractic with being the big cracks and putting you into all odd different positions. As far as pregnancy treatment is concerned, it's very soft and very gentle. I don't really manipulate my mums at all. I use very gentle techniques which involve like a little wedge and things that they lie on, and I have other various tools in my toolbox. But it's very much because of pregnancy hormones, how relaxed the ligaments and everything become, you have to take that into consideration and treat accordingly, and it is a much more gentle side of chiropractic.
What would be the top 2 or 3 things that a pregnant lady might see a chiropractor for?
Back pain, lower back pain being the classic one, tends to be more on one side compared to the other. So on our little model here, these here called the sacroiliac joints, and it's where the little dimple is in the small of your back. Those, because they've got a lot of big ligaments here that become nice and relaxed during pregnancy, that makes that joint move too much and it can create a real pain, pinpoint pain on that, like I said, that dimple area in the back there, and then that has a knock-on effect to the way your bum feels. So a lot of ladies say, I've got back pain, I lie in bed at night, try and lie on my sides, and it really, really hurts, and that's because this muscle's now getting tight. You also get a lot of ladies that have pubic bone pain or groin pain. Again, it's all the pressure of the changing ligaments becoming soft, the centre of gravity changing, so you're loading the front here a lot more. And lower abdominal pain as well, because you've got all your big muscles that are compensating and taking on more weight. So those are the sort of the key ones that I tend to treat.
Once lady's had her baby and maybe she's still feeling some of those aches and pains, does she have to wait for her 6-week postnatal sign-off from her health visitor or her GP before coming back to see you?
No. Again, it goes back to how gentle we treat. So if there's anything that's looking like it's really inflamed or anything, we work around it. You don't have to, because we primarily diagnose patients anyway, because of our medical training, that, you know, if we look at something and we think actually we don't want to go anywhere near this because it's too soon, then that's fine. Alternatively, we can make that clinical judgment on the day.
Cool. So obviously one of my whole business is working with ladies generally one-to-one. We do classes with Health Beginnings Fitness as well, but I do a lot of one-to-one work with pregnant ladies and postnatal. If they're seeing a chiropractor, would you recommend that they stop all exercise, or is exercise important to complement what you're doing?
Exercise is incredibly important. The muscles basically support the joints, and the muscles also have little nerve receptor cells in them that tell the brain all about the balance and how the body's working. So if you don't have strong muscle groups, your joints are not going to get supported, you're going to become much more susceptible to injury, you know, and especially as giving birth and being pregnant is a huge thing for your body to go through. So if you don't have strength to support your joints and your ligaments and give that brain of yours a really good sort of feedback system to tell you about what your body's up to, you're going to be in a vicious cycle of pain. So exercise is hugely important.
And I guess you back me up on this though, but it's the right type of exercise.
Yes.
It's choosing a specialist who understands the physiological and anatomical changes during pregnancy and takes that into consideration, and then works with your chiropractor as well, so that you can build like a whole picture to get that mum feeling tip-top.
Yeah, absolutely. You can't just pile straight on into something. Your body is still full of all the hormones. It takes a long time for those to come out. Mechanically speaking, you're going to be weak in areas and tight in other areas, and it's important that the form of exercise you take is gentle to start with, and build it all on up, because you have to be very considerate of the fact of the trauma your body's been through. You don't just get straight on the running machine and go for it.
So I know everybody's different, so it might be hard to answer this question, but what would a typical, like how long would a typical treatment last, and what would be involved?
Are you talking pregnancy or postnatal?
Either, both.
Both, okay. Pregnancy, a lot of my ladies tend to come in later stages of pregnancy, in which case, to be honest, I have to diagnose a problem, undo everything that's got them to that stage, and try and keep them going through pregnancy, bearing in mind bumps getting bigger, ligaments getting softer. So, you know, that tends to be, if you come in at say 33, 34 weeks, I see you straight through to the end. Yeah. If you come in postnatal, it depends if you're a C-section mummy, if you had a really traumatic birth. Yeah. So the rule of thumb is you would hope to see some sort of improvement between 4 and 6 treatments, because you have to undo everything that's dysfunctional, tight, loose, whatever, to get to your stage, and then you start feeling better. And
do you give ladies kind of homework to take away? Have they got to work on things in their own time?
Yeah, what I like to do with my ladies is have a really good chat about their lifestyle. How do they feed their babies? What do they do? Do they sit on the sofa with their legs crossed? Do they, you know, do they take the dog for a walk as well? How good is their nutrition? Because they have to meet me halfway. Definitely. Or else the treatment programme is going to take a lot longer, which gets them frustrated. Gets me a little bit frustrated, because you think, well, what am I not doing? And actually they come in for a treatment and then just go and slob out, and that doesn't work. So
it's the same with exercise as well, isn't it? And we're all guilty of it. We can't be, you know, perfect posture 24/7. Oh, no. It's impossible.
I'm normally crossing my legs, as I tell people not to.
Yeah. Thanks so much for taking the time to talk to us today. If there's anyone from Taunton watching this and they'd like to book an appointment with yourself, where can they find you?
Best place is to Google the Crescent Clinic, and the website will come up. It has all of our contact details on there. We also have a Facebook page, so if you have a look on Facebook for the Crescent Clinic, then that's the best way.
Perfect, thank you.